I also wanted to talk a little bit about the transportation in Ypsilanti. We are actually the only clinical section right now that's teleconferencing with India for our community nursing course, and I really enjoy it. It's something that I really enjoyed, and I've learned a lot. When we first started teleconferencing, I think we were all a little bit nervous. We didn't know what to expect.
The fall semester, we started collaborating with Salakaya. We would meet weekly through video conferencing to discuss all the logistics. And of course, the biggest challenge is always technology. Technology is very good, but it's only as good as the weather allows us, as the satellites allow us.
Pinky, can you see us?
We continue to adapt with it by just working through it.
What helped was that the instructor for the Indian students was very helpful in trying to organize our time and trying to really get to know us as students. And they had instructor meetings outside of our class that kind of organized what happened during our teleconferencing.
You guys have any questions?
Other challenges were trying to make sure that all the information that each of our groups of students had collected would get there before we would actually have the video conference. When we're able to do that, then our discussions can focus around more of comparing and looking at the similarities and the differences.
It turned out to be, I feel like, a really comfortable environment where both sides could mutually share information about where they live and their healthcare system.
And I think it's really initiated their exploration, community health-wise, globally, and to look more even in their own backyard as to what is present, what is needed. So I think we can always look at another country and say, oh, they need this, they need that. But it's really taught them to look at their own country, to look at their own state, their own community, their own blocks.
It was a new experience for me, and I learned a lot about the culture I normally wouldn't have.
You feel a common bond, like their fear associated with nursing school and being the best nurse you can be, and just having someone else's lives in your hands. That's a universal thing. It doesn't matter if you're in India or if you're in Michigan.